to record.
All right, so there's 4 blocks that I typically will do in a dog or a cat, and basically the infraorbital foramen right here, so that's the infraorbital block. It's going to be right there. And the infraorbital block is going to get all of your incisors, and it's going to get everything back to definitely your 07, questionably the 08, probably not the 9. And it depends what dentist you talk to, they all seem to disagree. And I think part of it is because of brachycephalic dog, you're probably going to get 08 and 09, but a dolichocephalic dog may not even get 08, which is the carnasial tooth. So what I do is, you can see where it is here, but I will actually lift up the lip. Like, I'll feel it on the outside, lift up the lip, and then you don't necessarily want to go all the way in, because if you go all the way in, you potentially could damage a nerve. And so if you feel that you're going all the way in, just back up a little bit. And so the goal would be to really inject right at the opening, right there. And what you'll notice you can do is, if you push your thumb over it as you're injecting, it actually kind of spreads it out more. So this is really the only one that you have that landmark where you can actually feel yourself going into it. And honestly, like, I think if you're like right next to it or around it, you're probably fine. The mental block, which is going to be right here, and I'll show you guys my landmark for that. Like, pretty much I never get in there. I'm just injecting right over the top. I just know my landmark of what I use and inject in that area. And then for the mandal, and that's only going to get your incisors. That's not even going to get the canine, because the canine, even though it's here, the canine tooth really goes there. So now the mandibular.
Sorry, people watch it later. You're good. Keep going. I got you.
Now the mandibular block is going to get everything. So there's no reason you'd ever have to do the mental or mandibular. Like, if I had incisors and I had like the 09 on the bottom that I was removing, I would just do a mandibular block. And the mandibular block right here, you can actually feel this ridge, and it's just like the high point right here, and you can feel it in dog and cat. The problem with these is because they're just heads. I feel like they're cut like right at that point, so sometimes it's a little bit hard to tell on the heads, but when you get onto a real dog, you can feel it really well. And what you're going to do is, you actually will find that high point, and you stick your needle in from the outside, and you actually are going medial to that bone. So you're going, and so I'll always kind of go in and push up. If you're lateral, it'll just come up, but you know you're medial. And a medium to big dog, I'm going all the way in. Like a little dog or a cat, I'm probably going most of the way. If you're using a needle that's this short, I'm still going most of the way in. And one landmark is it's going to be right at the lateral canthus of the eye. So basically, you know how that means. And so that's going to get all of your, all the cheek teeth, the entire mandible. And then the other block that I do is called the maxillary block. And so the maxillary block, what you're doing is, you're really coming in right behind this last cheek tooth, and your injection is going straight up right behind it. So it's a little bit like kind of weird and scary, and it's a little bit blind, and it's a little bit tough to get in there as well. Supposedly, some dentists say you cannot do this in a cat, but they feel like because cats' faces are so short, that just doing the infraorbital block is fine. I've heard some dentists say that it is fine to do the maxillary block. I guess I would leave it up to your preference. Like, if you're someone that's just a little bit concerned that you're going to cause nerve damage or a problem, and sort of less is more, then maybe just stick with the infraorbital block. With dogs, you can totally do a maxillary block, especially like a long-snouted dog. I would do the maxillary block if you're removing a carnasial or a nine. And so the maxillary block is basically just going right behind that.
What about like brachycephalics with that block?
So, I think it's debatable. Like, going to brachycephalic, I probably would do the infraorbital for an 08 with a carnasial.
Okay.
But if I was taking out the 8 and the 9 or the 9 and the 10, I'd probably do a maxillary block. But there are tons of people that don't do blocks at all. And I feel like even in a brachycephalic dog, if you're kind of freaked out about the maxillary block, even doing the infraorbital potentially is going to be good. So, like, you can always stick with that for now. Maybe once you get more comfortable with the other blocks, then you can start doing the maxillary blocks. And then the cat is going to be similar, but you can see their orbital frame is right there. And see how close it is to the eyeball?
Yeah.
So just like the cat's, the one thing is like no matter what you're doing in dentistry, be aware of where you are and where the eyeballs are. Because the two things that you don't want to call an owner is one, your cat died under anesthesia for a routine dental, and then the other one is we need to go in and remove your cat's eye because we just ruptured it. So like no matter what, like even if you, I've had these procedures where I just come out like so dejected and I feel like I left a piece of a root in, and then we had the cat under anesthesia for like 3.5 hours, which was too long already because 3 hours should really be the max. And like you have to call the owner and let them know, hey, we think we've left a little piece of the root and it shouldn't be an issue. But something, you know, like you walk out of it feeling horrible, but you should be thinking, cat's got both eyes,
Yeah.
and the cat is alive.
Yeah.
So I always tell myself that to try to like make myself feel better. If you are doing a procedure and you realize you have like 9 or 10 teeth removed, and you're 3 hours in and you've only removed like 4 or 5, you should stage it, meaning set up a second procedure, and so you call the owner and let them know that, you know, beyond 3 hours, we see an exponential increase in anesthetic death, you know, and anesthetic complications, and so really we want to limit them to 3 hours. For a lot of people, it's more about the money, so they're like, well, wait a minute, now I'm going to have to pay for hospitalization again, and a catheter, and the fluids, and the setup, and there's a lot of redundancy in charges. And so what we've decided as a region, like, I don't know what they do on the West Coast, but at least in the entire Northeast, that we charge it as if it's 1 6-hour procedure rather than 2 3-hour procedures.
Yeah. All right.
So this for the second procedure, you put in all the charges like you normally would, but then discount all the charges that you already charged for in the first one.
Okay.
And so you're letting the owner know that the charging is no different than
You're
if it's
picking
1
up where you
6-hour
left
procedure.
off. Okay.
You know,
Like an intermission.
So
Yeah,
I feel
that's
like
great.
that alleviates some of the frustration of the owner.
Yeah.
The other thing that's really good is if you know that this is a case that might be a stage procedure, if there's a lot of like disease in the mouth and potential mouth extractions, telling the owner during pre-op or at the exam, look, this is really messing up, there's a possibility we may need to stage it, is huge, because then when you call the owner and you talk to them and you're like, hey, I'm really sorry, you know, we only were able to remove 5 of the 12 feet that we needed. You know, we're going to need to stage it. They'll be not happy, but they'll be like, oh, you know, so the best part is like, you're in the middle of the dental, you're talking to the owner, and if they say, wow, you know, Dr. Spencer told me that would be, you know, a possibility. I was just hoping you'd be a good one.
Right.
You're like, thank you, Dr.
Yeah,
Spencer.
exactly.
Yeah.
You know, so it's so much better to kind of set people up in advance that that's a possibility.
Well, and if you don't mind me saying something about that too, because that is one of the main reasons why these nerve blocks are so critically important, because you are able to maintain a much better, more even plane of anesthesia in the first place, and we have far fewer complications. When those are done, you can keep your anesthesia lower, the patient is more stable, and then sometimes you gotta push that 3 hour. Like it's, I mean, you guys know I'm in dental sometimes 4 and 5 hours. We stage procedures a lot.
And I feel
but
like
the
that, the one that we
blocks
did, I feel
really
like was
have-
like 3.5.
Yeah, we were
Yeah.
broaching.
Yeah. But we are also very, very careful that if we're making that decision to keep going with that patient, that anesthetic plane, that
Right.
patient's been doing really, really well.
Right.
Okay, and so those blocks are really important.
Yeah.
And so you might ask, like, how do you know if your block works? Because Jolene's doing anesthesia,
Yeah.
and she's got the PET on like 1% ISO instead of 4%.
Yeah.
So she'll actually be much more aware of whether your block worked than you did do if you're not looking over.
And a lot of the time when you inject, the dog goes, and then you're in the right spot.
Yeah.
Or it sits its head up and says, hello.
And the same thing with the cats with the mental block. I mean, there's no way you're gonna even get in here. So I'll show you my landmark. And then the mandibular block, you can't really feel it here, but they have that same groove that you'll feel it, and it's right at the lateral canthus. And I'm gonna go in, you know, almost not all the way, but most of the way. And then the maxillary block, I used to do them until I was told not to, and I never had an issue. But I think in a cat, you could just see like, look where the cheek teeth are and the foramen, and so you're really close. I mean, it's, you know, so I think you're fine just doing it in full block on a cat. So I'm gonna show you one of the real heads, and then I'll have you guys practice.
And I angled down slightly for the cat and
That's
for,
smart.
yeah, and for
Oh,
orbital, just,
okay.
you know, you're not even 45 degrees, you're just angling down, you're sort of picturing
We
where the
also
eyeball is
have
and
those
trying to look down
laminated,
below it.
laminated guides behind the screen, computer screen,
Yeah.
that we can pull out and look at as well, and they go over everything Dr.
Right.
Berkowitz just said.
Now,
And we
your
pull them out all the
question
time.
should be what do you use and how much. And so I've gone through over the years I've used different things. So I started off using lidocaine, and then the feeling was that the lidocaine is so fast acting, even though it's working right now, it's not going to be working in an hour from now. And then the thought was, well, we want it to work right away, so let's mix it 50-50 with bupivacaine, lidocaine, and more recently, a lot of the dentists were like, well, it's not enough for the bupivacaine, so, you know, you're it's working a little bit now and working a little bit later. So I actually use 100% bupivacaine now, but you want to try to, if you know you're doing extractions, try to do those blocks, like 15 to 20 minutes before you're actually doing the extractions. So like even earlier on, like if Jolene's like, oh, you got a slab fracture carneasial, this tooth is going to go, this tooth is going to go. Early on is a nice time to do those blocks. Honestly, there are definitely times where, just based on how things happen, I'm doing my blocks right beforehand. So it does happen. I've noticed some docs will do 90% bupivacaine and 10% lidocaine.
We're about, I would say with the charts that we have, about 25-75.
Yeah.
Okay, which is
yeah.
totally, like no one's, if you talk to 10 different dentists, they'll tell you
Right.
10 different things.
Right.
The newest thing I heard is using 90% bupivacaine and 10% buprenorphine. So that's kind of like an interesting combo, just another drug to log though. But that's always an option as well. For my guide, like you could calculate the toxic dose of bupivacaine or lidocaine, but I think an easy way to do it is just a cat and a little dog gets 0.1 at each site, up to 4. A medium-sized dog is going to get 0.25 at each site, up to 4. And then a big dog is going to get 0.5 at each site, up to 4. So like a big dog would get a total of 2 cc's, medium-sized dog would get a total of 1, and then a little cat or a little dog would get a total of 0.4. And sometimes, if it's like, maybe that 20 to 25 pound dog, I'll give the 0.25. If it's like a 35 pound dog, sometimes I'll give like 0.3. So like, I sometimes will give it in betweens. If you know you have a big dog and you just have a carneasial slab fracture, and it's just one extraction, you could potentially put 2 cc's in one site. The only problem with that is I've had cases where we realized after the fact that there's an issue someplace else and we have another extraction. And if you just put 2 cc's in that one site,
You're
you don't
done.
really, you know, now you start having to do a calculation to make sure that you could give more and be okay. So I usually still stick with like the 0.1, 0.25. So those are my basic guides.
There are also times when I'm cleaning that the pet's chattering or I can't keep them under. So I usually call Dr. Corrigan in and say, hey, can you block them now? Because
Which
I
helps dramatically
can't keep
when
them
you
under
ask them to do it.
anesthesia or they're chattering quite a bit.
And you could also give an additional block. Like let's say you have a medium-sized dog where you just had one extraction, you gave 0.25, and Jolene's really struggling and feels like it didn't work at all. You could always then give another 0.25 in that spot, or maybe you would do 0.25 of more lidocaine, to work with her.
Yeah. Well, and if you guys want, we have a chart here that calculates all the weights. And whether you're doing 1 site, 2 site, 3 site, 4 site, and it does the calculation for the lidocaine and the marcaine, and that was given to me by a veterinary dentist in this area, Dr. Eric Davis. So this is what he uses in his practice, so that's, he said, okay, that's what we'll do, because it just does the thinking for you. So it's nice because he's kind of underestimating slightly, so you always have a tiny bit extra if you really need it for maybe repeating one of the sites that you did, or splashing over something, or whatever you got a little extra. But I can show you guys that. if you want.
Does he have any, I feel like it was a recent thing, like where there was a concern of using the two together and actually like negate, like partially negating the effects of 2 different kinds of sodium channel blockers.
You mean
Like doing Americaine lidocaine versus like straight bupivacaine?
Oh,
I
so-
feel like
I don't know.
So we asked the dentist about that, and
Okay.
they said for them, and these are anesthesiologists, for them, they said it wasn't that they were negating each other.
Okay.
It was just that you were using a lower dose of each, and so the effects of each wasn't going to work as well. Meaning, If you wanted it to work right away, you were using only half the dose you needed to work right away.
Yeah.
If you wanted to last long term, you're only using half the dose of what you want to use long term. So this is our, all right, so just so you know, these are,
I'm
we
gonna
get
be
them
right
from
behind
a
you.
company called Skulls Unlimited. Yes, the company is really, it's www.skullsunlimited.com, which is a great website. And they get the, did you like the box that came in?
We have it right out
Yes,
there if
it's-
anybody
I think
would
it
like to
says,
see
like,
the box.
It says like wildlife products. in
It does.
So this
Okay.
I think it was last night I was watching CNN and they had a report on how
Oh.
no, it was I was watching the Greg Gutfield show, and which is kind of like a goofy show on Fox, and they were talking about how now there's a bit of a concern because biology students are being sent
Yeah.
animal parts in the mail.
Yeah.
For them to dissect at home because they're at home, and whether that's appropriate or not. And I was
Oh
like,
dear.
Oh no.
I was like, well, that's I feel like that's no big deal compared to this. So these guys are dogs that were euthanized at like shelters, and
Oh,
basically
okay.
Skulls Unlimited has a contract with them that these were dogs that were being put to sleep anyway, and so instead of just being cremated, they use the heads for like dental wet labs. You can't, like, you guys could call and order it, but like a random person, like they have all kinds of stuff. Like I think anyone can order one of these
Oh yeah.
that wants, like you can order all kinds of stuff on there of all different species. But for something like this, you have to be a veterinarian calling from a veterinary hospital, or else they will not. Like, so it's not something that
That's
they.
good.
that
Yeah,
anyone
yeah.
wants.
That's comforting.
Are they very expensive?
So I want to
have the
say,
receipt.
like it's maybe a dog head's like 110, and
Oh,
a cat head is like 90 something. And like a great reason to have it is for your text to practice dental X-rays. So if you guys wanted to hang on to any of them, practicing the X-rays, you're welcome to. If you don't. And then if you guys want to take the head back to your hospital with you, you're welcome to. You know, if you want to keep practicing. But you won't- Yeah. So on Thursday, one of my texts in New Jersey said, before I left, she was like, hey, is there a way that we want to practice dental X-rays? Is there a way you can bring one of the heads back? And I was like, no problem, because we have 5 of them. And I get home, literally like unpacking my car, my wife walks out, and we have a freezer in our garage, and I come out with the black bag, and my wife just looks at me and she's like, I don't even want to. Fortunately, she's a vet, so she gets it. But I think like the last one we did last year, we had like regular food in it, which is probably not appropriate.
Oh dear.
I didn't tell her the last time, and like I had it in there for I think 2 or 3 days, and like after like 6 hours of it being in there, she came up to me and was like, "What's in the? I don't even want to ask."
Yeah.
So if you on these guys, so I'm feeling for the infraorbital foramen. So I can feel right in here. I basically can feel that little hole. So I can feel it right there. And then what I'm going to do is I'm just going to lift up the lip. And now I can feel like I'm in there now. So I back up a little bit, pull back, and then I give my injection. And I think you don't have to be in the exact spot, but you just want to be close. You don't want to dig around because then you're more likely to develop nerve issues. And also, if you push your other thumb over it as you're injecting, that's going to disperse and spread it out more. So that's the infraorbital shot. You can see on this guy, look how far away I am from his eyeball.
Yeah.
But on a break stop dog and a cat, you're so close. So my landmark now for where the mental block is, I always mean to look up the name of this frenulum, but basically what I'm doing is it's sort of right below the 05, and so I will actually go with my needle right in front, just like that, and then I'll pull back and inject. And I might push my thumb down at the same time. But I'm basically right in this area right here. And there's really not that much, real estate right here. So, even though you're not going exactly where it is, it's hard to miss. And then for my mandibular block, I can feel, this guy's actually, has a really good notch. So I can feel the notch right here, which interestingly, it's actually a little bit further back than the lateral canthus. And so I'm basically just gonna go and see how, I mean, it looks like I'm so far, like, you know, and I'm pushing up against this, and then I'm just pulling back and injecting. So that's my mandibular block. And then the maxillary block, if they're a little bit too frozen still, you can kind of go like this, don't put your mouth on them. So I'm actually gonna go literally right in back here, just right behind that last, you see that? Right in there. And this dog, I'm just gonna go all the way to the hub. You know, maybe a cat or a small dog will go all the way to the hub and do my injection. So you guys can now, let's open these guys up.